Well, a new study on domestic violence in the Cochrane area released this morning aims to help law enforcement and other agencies stop the violence before it starts. Lana Wells is the lead author of the study and the Brenda Strafford Chair in the Prevention of Domestic Violence. Lana, thanks for taking time for us this morning. And first, let's start with kind of the details of the study. What was the time span and the data that you were looking at here?
Sure. This is a new study out, first in Canada, using RCMP data, and we were looking at trends among men who use domestic violence in Cochrane and surrounding area. So we had two different data sets. We looked at over 5 years, people have been charged in incidence and severity, and then we also did a deep dive in 2020-24, where we looked at 112 men who had been charged with domestic violence to see if we can learn about risk factors and what we could do to stop violence before it starts.
Yeah, so that was obviously one of the big focus is learning about why it is happening. So what did you learn?
Well, we learned that in about 2/3 of the cases where men get charged with domestic violence, police had already shown up at their house. There had been a domestic violence encounter. And so we know that there's actually an opportunity to intervene earlier to divert a future charge.
Alcohol, too? I mean, that stood out reading this report right away. I mean, virtually half of these incidents involved alcohol.
Yeah, I think two important points. In over half the incidents, children were present, and we know this is a form of child abuse. And we also know children who are exposed to violence can go on to become victims and perpetrators and have a higher risk of that. And as you mentioned, we also saw that in 50% of the cases, alcohol was present. So we know alcohol is not a cause of domestic violence, but it's definitely a contributing factor. And if we're going to do anything, we need to be working with addictions and violence prevention efforts.
What did you learn about reported incidents? We've long talked about one of the main issues around domestic violence is that many of these incidents don't get reported. Are we seeing any changes around that?
Well, interesting. In Cochrane in the last 5 years, incidents and charges have gone up. Incidents of domestic violence encounters went up almost 60%, and charges went up over 15%. And we also learned that the severity of the charge is increasing. That means assault with a weapon, assault causing bodily harm. We're seeing higher incidents of physical harm. And we know there's a lot of risk factors before we get to that point, and we need to be thinking about how we can intervene earlier.
Yeah, so you're releasing some recommendations. We've got them here. Let's go through a few of them. Starting with mobilized communities, what does that look like?
Yeah, I think because we know 2/3 of the men getting charged with domestic violence had a police encounter prior, and it was around domestic violence, but there wasn't enough. It didn't reach the threshold of a charge. We think police could be changing their practice when they're showing up and connecting that man and his families to community supports. And that is really critical, which leads to we actually need more programming and supports for men. But we also need more men reaching out. So we need to destigmatize help-seeking behaviors and get more men reaching out to their friends, their family, and professional services in the community.
Okay, influencing policy change, that's going to be a big one. What does that need to look like?
It is. We need child welfare. We have 50% of the cases where children are present. We need child welfare at the table. We need policy changes that we're actually investing and supporting men, especially think about young dads or new dads or fathers. It's an opportunity to actually work with men to build their healthy relationship skills so they can model it to their kids and family.
You mentioned this can kind of be a circular thing, goes to kind of number 7 here with the recommendations. What can we do to protect and support children who are exposed to this?
Yeah, I think as neighbors, as family members, as an individual, I think we need to learn about the risk factors and what's showing up in our networks, because we know in Alberta, 2/3 of people know somebody who is experiencing or has experienced domestic violence or sexual violence. So I think every Albertan needs to build their skills and awareness around understanding the issue and then how to lean in and to provide support, not only to victims, but how do we disrupt this behavior with men and young boys?
Okay, we'll see if these recommendations turn to policy. Lana, thanks so much for your time this morning. Really appreciate it. That is Lana Wells, lead author, and Brenda Strafford Chair in the Prevention of Domestic Violence.
Thank you.
Thanks.